Hello, welcome. Today we are talking about ear infections. There are things you have to know concerning ear infections. My point of concern is that why are young children most likely to suffer from ear infection as compared to adults? Now, there are questions you also have to know. What is ear infection? What are the signs and symptoms of ear infection? What causes ear infection? Why are children more likely to suffer from ear infection as compared to adults? And how will the parents identify that their child is suffering from ear infection? So, ear infection is an inflammation of the middle ear, which is caused by a bacteria which builds up fluids behind the eardrum. There are different types of ear infection. There are three major types of ear infection. You have otitis media ear infection. But before I proceed with the different types of ear infection, you also have to understand that another name for ear infection is called otitis media. Otitis media is another name for ear infection. Now let's go to the different types of ear infection. Three major types do exist. We have acute otitis media ear infection. Acute otitis media ear infection occurs when there is an inflammation in the middle ear. When there is an inflammation in the middle ear, it causes that area to swollen. It causes the middle ear to swollen, and this exerts a lot of pain for the person who is suffering. Exert a lot of pain, and when this area is swollen, this bacteria now builds fluid behind the eardrum, so it makes the child to be very very uncomfortable. Now the second time, and you also have to understand that the acute otitis media ear infection is the most common type of ear infection that most children do suffer, and it gives a lot of headache. It gives a lot of ear ache, that means pain in the ear. So the second type of ear infection, we talk of the otitis media ear infection with effusion. Otitis media ear infection with effusion occurs when the fluid, that means you have once suffered from ear infection. Now when you have suffered from ear infection, the fluid now are trapped behind your eardrum. Most apparently it appears without any symptoms. It appears without any symptoms, but it makes the child to be very very uncomfortable. Now the third type of ear infection is the otitis media chronic infection. That means chronic otitis media infection. The chronic otitis media infection occurs when the fluid remains in your middle ear for a very long period of time, or keep on occurring over and often. So at this moment it causes a chronic otitis media ear infection, and it may likely impair your hearing, and it makes it to be very very uncomfortable. Now, what actually is the cause of ear infection? Ear infection is mostly caused by a bacteria, but among young children, can have viral origin also, especially common cold. Yeah, this you see a child begin to have common cold, or other upper respiratory illnesses. The child will have common cold, and then maybe the child will be having sore throat and so on. But since these children are toddler, or they are very young, at times they cannot express themselves. But you are the parent, how are you going to identify that the child is suffering from ear infection? Now, so this bacteria which causes ear infection is mostly known as Streptococcus pneumoniae. So is mostly responsible for otitis media, which is also known as ear infection. So it makes the child to be very very uncomfortable, as I earlier said. Now my main concern here is, why are children more likely to suffer from ear infection as compared to adults? Point number one, we talk of the eustachian tube. The eustachian tube of children is mostly flat, it's mostly leveled. Now, it's mostly leveled and is small, and it makes it very difficult for fluid to drain out of this tube. It makes it very difficult for tube to leave the tube because of the small size, especially when it is inflamed. So a fluid, or when the area is infected, fluid is infected and inflamed, fluid cannot leave out of the ear. It makes the fluid to stay or to trapped in the middle ear, causes a lot of pain, or exerting a lot of pain for the child. So that's the first reason why children are more likely to suffer from ear infection as compared to adults. And point number two, the second reason is that we talk about their immune system. Children immune system is still developing as compared to adult. Now, their immune system, since it's still developing, it cannot be able to fight infection properly as compared to adult. That is why children are more likely to suffer from ear infection as compared to adult. And point number 3, we talk of the adenoids. We talk of the adenoid. The adenoid is a passage that passes through the mouth and the nostrils, and passes through the mouth and the nostrils, carries bacteria. Now, when it carries bacteria or passes through the mouth and the nostrils, these bacteria are being trapped within the adenoid. Some of these bacteria at times are being trapped within the adenoid, and in most cases it causes chronic ear infection. That is point number 3 as compared to adult. Please, as a parent, always monitor your child. Always monitor your child. The child may not be able to express herself, the child may not be able to express himself since the child is a baby. But you, as a parent, how will you actually know that the child is suffering from ear infection? Don't forget that when the child is suffering from ear infection, they cannot talk, the child will keep on crying, the child cannot sleep, the fluid may be draining from the child ear, and that is where you even realize that the child is suffering from ear infection. Don't forget, when you observe such abnormality, don't forget to consult the doctor, or don't forget to rush with the child to the hospital for medical attention. Thank you, and don't forget to follow my page. Just follow my page for more health tips. Thank you.